Hey, if you're clicking on this video, you are suffering with runner's knee or patellar tendonitis. You've got that pain kind of right underneath your kneecap. We're going to go over all the exercises here for our long form video. As always, we're going to follow the structure of mobilize, stabilize, stretch. We've got quite a few to go over. Now, the thing that we always remember, never go to pain if it hurts. Like maybe a 2 or 3 out of 10. We can handle that, but you're not going to go above that. Otherwise, you're going to just be irritating the problem. So always remember that as we follow the mobilize, stabilize, stretch, that everything needs to be pretty comfortable. Never be afraid to discontinue something. If it hurts, stop. Don't push through it. You can modify, and so we'll maybe go through some modifications. But if you have any questions, message me, and we're going to get going here with our first mobilization. So in the first mobilization, I'm here in this video using a mat. You can just do it on carpet as long as you're comfortable there. We're just going to go through some hip and knee mobilizations. Now remember, this is for patellar tendonitis. So we're going to go back and forth about 10 times. And if you notice in the video, I'm getting a little bit deeper. So as you're rocking back and forth, go ahead and lean forward just a little bit more and back just a little bit more. We're just trying to create some mobilization. The knee that is up is the one that you're really focusing on. However, both knees are going to get mobilization. So you can do one knee and then switch to the other side. Okay, now we're going to move on to our next mobilization. As you see, I'm just sitting in a chair. We're going to go through mobilizing the patella. So in the first one, I'm going up and down about 10 times. You want to kind of slightly straighten your leg. You don't want it like really bent, otherwise your kneecap won't move, but we're just going to lightly mobilize up and down. Should be very comfortable. Now we're going to go side to side. Again, I'm not necessarily, looks like I'm moving the whole leg, and you may move the leg a little bit, but really we're mobilizing the patella, your kneecap. Okay, again, needs to be very comfortable, and you want to make sure that you're not getting any like dislocation or big movement. Slight movement is fine, big movement not fine. Next, we're going to go to our tibia pivoting. Now what I'm doing here, and I cut this video off, so I'm just tapping my foot back and forth. So you're going to lift the foot up and you're just tapping back and forth. The reason why I've got my hand down there is you're just feeling to see if you can feel the tibia, the bone just below your kneecap. You're going to go back and forth about 10 times. Okay, so we're going to go through all those mobilizations, and then we're going to go into our stabilization. So we're going to get stronger here. Now, in this one, we're going to do a single leg squat. So if this is too hard, you can just do into a double leg. Well, if there's any pain again, we want to discontinue. And as you notice, I'm really struggling. I start to tip. I'm able to keep the leg up, but really this is difficult. So I did that for about 15 seconds. You want to go about 15 to 20 seconds. But with this, oftentimes we'll repeat. We'll do like the full round of exercises. Since these are a little bit harder, we'll just start with the wall squat, the single leg wall squat, or double leg wall squat if you want to modify it. And again, the deeper you go, the more you're going to stretch, and the more shallow you go, the less it's going to strengthen, but we don't want to go to pain. Okay. Next, we're going to go to a step down. Now on this, I'm just using my treadmill. You can use a stair. I suggest using something you can stabilize yourself with, like a banister or even a wall. Now, the leg that we're working on is a leg that's up. So the leg that we're stepping down with is not the workout leg. We're going to do 10 step downs here. And again, this is pretty difficult. You want to hold that really slow and stable. I'm trying to just kind of support myself for balance. So notice I kind of let go and not let go. Depending on your pain level, if you're feeling pain, use that arm to assist a little bit. But we're going to do 10 down and up. And again, you want it nice and controlled. Focus on the knee, the leg that you're standing on. And we're going to go through as full range of motion as we can. So just kind of tap that heel down, and then we're going to move on. All right, the next exercise that we're going to be doing here, we're just going to go into a lunge. So notice I'm just going to drop down. My knee, the back knee is slightly off the ground, and we're just going to hold. We're going to hold here for about 15 to 20 seconds. Again, this is harder than it looks. Notice I'm leaning forward just a little. You want to try to be up as straight as you can. Again, focusing on really the front leg, but both legs are going to get a workout, but that front leg is the one that we're trying to strengthen, that muscle that's going down into the patellar tendon. And we're going to hold that for 10 to 15 seconds. Next, we're going to go into single leg stand. So the leg that I'm standing on, slightly bent. Again, we're trying to kind of work out that tendon. But here, I do 10 seconds with my eyes open. And then notice I point to my eyes and I do 10 seconds with my eyes closed. And notice how much worse it gets. I'm wobbling all over the place. This is on purpose. What you're trying to create here is anytime you have an injury, you're trying to increase your proprioception. That's your body's ability to know where it is in space. So by doing a stand and a balance with your eyes open and then close the eyes, you're actually trying to increase that neurological connection between your brain and the muscle. And that's going to not only help with the pain and the injury, but it's going to reduce problems so you don't get re-injured. All right, now we're going to go into our stretch. So we went mobilize, we did stabilize, and now we're going to go into a nice little stretch. So just a single leg stretch. Oftentimes I'm just pulling back and stretching that, really the quad, but you're focusing on driving that leg back, not putting too much pressure onto the kneecap, but nice pressure. And I do this for about 20 seconds. So 15 to 20 seconds. You can even go 30 on some of these stretches if it feels good. And you want to use some support. So if you're wobbling around, just hang on and be close to a wall, or I could have reached up and used the treadmill, but we're going to hold that stretch. Our next stretch, we're going to stretch the gastrocnemius. Now I'm stretching the back leg. And on this, you're going to do a straight leg for about 10 seconds, 10 to 15 seconds. And then notice I'm going to bend. So there I point to the knee. I'm going to drop the knee down. You'll feel the stretch go from high up into the calf muscle to lower down into the tendon. And really, you could say this is the opposite, but remember that antagonist. So if you've got the front is where the pain is, if you stretch the back, that's going to take pressure off as well because you want to loosen that antagonist as well. So that's why we're going to stretch here for 10 seconds, the gastrocnemius, and 10 seconds with the soleus. And you, again, can go a little bit longer. The stretches, I usually say, anywhere from 10 to 30 seconds. Now for this last stretch, we're going to go into just a runner's hip flexor stretch. But again, we're stretching the hip flexor, so it's the leg that's down now. We're stretching that quad and the hip flexor. That's going to take pressure off of the patella. You can also focus that as you're leaning forward, you can do the leg that's up. You can lean forward just a little bit. Just make sure that you're not arching too far back. And you're stretching the arm up. You don't have to lift your arm up, but that's going to increase the stretch of the hip flexor. Again, these are muscles that you're stretching around the patella. And those are all of our exercises. So we've gone through our mobilize, our stabilize, and our stretch. And you should be able to do these, again, with no pain. I went through all these once. The exercises are a little bit more difficult. That's fine. If you want to, you can repeat this entire routine 2 to 3 times. Remember, don't go to pain. I mean, you can repeat 1 to 3 times. You can do more as long as you don't break rule number 1. But usually when I'm doing these, I'll do it anywhere from 1 to 3, depending on the time that I have. The key is to go out and be consistent. I would do these at least 5 days a week, especially if you're suffering with patellar tendonitis. But if you can, do them every day. They should be simple, they should be easy, and should not take much time. But you're going to turn your pain into power, your weaknesses into strengths. You're going to get past that patellar tendonitis. Just go out and be regular with it. Okay, see you guys.